of the new funding. I appreciate that to a large extent housing, health and social care are all interconnected and they need to be considered together, which is the basic thrust of today's statement. So we do appreciate that sentiment and we acknowledge the need for different departments to work together to achieve these aims that you've set out and not to work in silos. So I think that applies both at government level, where you have to work alongside possibly 2 other ministers to achieve these aims, and also at more regional level. So I think it's a good move to have housing needs included in the regional partnership boards as a statutory obligation. One basic issue regarding these 3 integrated areas is, are we building enough bungalows in Wales? Angela Burns touched on that. She raised the issue of bungalows, but Angela raised a number of valid points, and I wasn't sure that this basic fundamental question was actually answered by you. You answered a lot of points, but so I'm interested in what you think about this simple issue of the number of bungalows that are being built. There are a variety of home adaptations that can be carried out to make homes more habitable for residents who have developed physical or mental issues or who have simply got older, because there is a question of priorities. You mentioned different groups. You didn't mention veterans. So are they part of the Integrated Care Fund programme, or are they part of are they coming under another scheme? So I would like some enlightenment on that issue. But obviously there is going to be this problem of priority. There are lots of different groups. You did state that there's a number of there are certain percentages of funding that will be allocated in different ways. I suppose one basic issue is, will there be a coherent system of priorities which is easily understandable to the applicants that are applying for grants for things like home adaptations? New technology can sometimes be used to benefit the lives of fairly housebound people. For instance, a lot of day centres have closed in recent years. People living in rural areas may not be living close to a day centre in any event, so loneliness and isolation have become a major problem. Can we investigate home adaptations which encompass older people accessing facilities like Skype or something similar, or even in training them, those who are interested in accessing the internet? Could that form a cost-effective part of home adaptation? Obviously, we need to have broadband in those areas first. I was intrigued by Di Lloyd's vision, which I think is a good one. This idea that older people can sometimes live in semi-communal forms of living, which will often be more beneficial for many of them. There's also something called reminiscence therapy, which can benefit people who are experiencing difficulties with their memories. This can be incorporated into the kind of village complex that Di was referring to at one point. So I wonder if this can be incorporated in some way into the government's programme. Thank you.
Thank you very much for those questions, and glad that you began by acknowledging that it's important that we don't work in silos with this regard, and I think it's important the Welsh Government shows leadership in terms of being able to work across traditional boundaries, especially when we are asking local authorities and health boards to do difficult things, including pooling budgets through the Social Services and Wellbeing Act, and that's one of the key roles of the regional partnership boards, because making effective use of resources is a key priority for those boards, and those pooled funds and improved integrated commissioning will result in greater resilience in the provision of services, with a focus on improved quality and not just better value for money. And we have been assured that all regional partnership boards are now delivering a form of pooled funds in relation to care homes for older people. We want to ensure that there are fully formed pooled funds in place that deliver effective joint commissioning by April of next year, and the Minister has made it clear that we will consider intervening directly if that's not the case. So yes, it's important the Welsh Government shows leadership, and I think we've done that through Prosperity for All, which recognises housing and social care as 2 of our 5 cross-government priorities, and we recognise that there's roles for all of us across government to be working together on these agendas, and it's certainly not one person's responsibility to be delivering. Are we building enough bungalows? No, definitely not. I was really pleased yesterday to attend to visit the new development in my stag with my colleague Hugh Davis, and they are building new bungalows there, and that's really exciting because actually we don't have enough bungalows being built. I was talking to the developers as to why, and they're often seen as being quite inefficient in terms of building them, because they are, per square metre more expensive to build than other houses. But equally, bungalows really do meet the needs of older people who need to be living on one floor, for example, and who need a fairly small property to be looking after. So I would like certainly to see more bungalows being built. And the ones which were being built yesterday were being built through a housing association with the specific aim of supporting people to live in those accommodations as part of their social housing offer within the local area. So I think that it's important that that's considered by RSLs, for example, as they're thinking of their forward work programme, and also by local authorities as they're considering their local housing needs analysis, for example. In terms of priorities and how will regional partnership boards know where to be focusing their efforts, alongside a letter to regional partnership boards today, as a result of this statement, we're also issuing programme guidance for this fund. So there should be no doubt in terms of the minds of regional partnership boards as to where we would want to see that funding deployed. I completely agree that the use of new technologies provides us with real opportunities to support people to live at home for longer and to monitor people's care needs, monitor people's health and so on. And that was reflected in some of the answer that I gave to Di Lloyd. Again, I think building the right homes is also about building communities, and that very much speaks to that point which you made about tackling loneliness and isolation, which we know is becoming a growing concern for many older people, but not exclusively older people across Wales. And so building homes which are also communities, such as the one we saw yesterday, I think is a wonderful way of being able to tackle that as well. In terms of the groups who this funding is intended to support, those groups are set out through the Social Services and Wellbeing Act, and they are older people with complex needs and long-term conditions, including dementia, people with learning disabilities, children with complex needs due to being disabled or illness, and carers and young carers. So those groups are specifically set out through legislation. We do have a very strong link between the Dementia Action Plan and the Regional Partnership Board's work. The plan focuses on what service users with dementia and their family members have told us that was particularly important to them. For example, timely diagnosis and then the provision of person-centred care following that diagnosis. And the implementation of that plan is being supported by £10 million of government investment, £9 million of which has been allocated to the regional partnership boards through the Integrated Care Fund mechanism, so aiming to drive forward and enable integrated working between social services, health, housing and the third sector and independent sectors to support people with dementia and their carers. And to support this, we have issued addendum ICF guidance, which was produced specifically with the Dementia Action Plan in mind.
Jenny Rathbone.
Thank you very much. It's a pleasure to see the government embracing the parliamentary